President Trump is telling Congress not to waste their time on extending Obamacare subsidies and that Americans should be able to negotiate and buy their own insurance. In a Truth Social post, the president said, "The only health care I will support or approve is sending the money directly back to the people, with nothing going to the big, fat, rich insurance companies who have made trillions and ripped off America long enough." Joining us now with more on the future of the Affordable Care Act and what Republicans are planning, Senator Markwayne Mullin. He's the liaison between the House and the Senate. Senator, it's good to see you.
Joe, good to be on again.
I understand, we had one administrator, the president for 4 years. Now we've had him for another year. I understand a lot of the bluster and a lot of the things that he says, obviously. But if you don't want any profits earned by the insurance industry, then you're talking about government-run insurance and single-payer and, the public sector. So I know the president doesn't really mean that. He does think that there needs to be a profit incentive, obviously, in the private sector. I don't think he wants to socialize our medicine. What does he want?
Well, he absolutely does not want to socialize and have a single-payer system in our health care like the Democrats want. What we want is for taxpayer dollars to actually be used for what their intended purpose was. We don't want to subsidize insurance companies that are very profitable. I have nothing against companies being profitable. I'm a capitalist. I want companies to be profitable. However, if they're making a profit, why are we padding their pocket any farther by subsidizing insurance companies when we've seen their stock go from, in 2013, some stocks went from $30 to $330 a share. They're being extremely profitable, which is great. We want them to. However, we have a health care system that was sold to us, Joe, by saying it was going to be affordable health care. Remember, it was President Obama that went out and said premiums were going to go down 25%. They're up 221%, expected to go 230% by the end of the year. It was supposed to be if you liked your premiums, your package you have now, you could keep it. It's been reduced. And we knew this was going to happen because when you add on mandates and regulations into any sector, the industry that has to absorb that isn't going to absorb it to their bottom line. They're going to pass the cost on. We know Obamacare, which is, affordable health care, is unaffordable for the American people, and you can't fix it. You can't fix a blown motor by putting more subsidies or more money into it. At some point, you got to rebuild it or you got to replace it. And what President Trump is saying is this isn't working. Quit giving subsidies to profitable insurance companies. Let's give it to the American people, allow them to make a decision to actually have a plan that works for them and reward them for being healthy. I mean, think about this. Healthcare is the only industry that you're not rewarded for taking care of your responsibilities. If you think about homeowners insurance, if you're within 500 foot of a fire hydrant, your insurance goes down. If you keep shrubbery away from your house, if you have fire protection inside your house, if you have an alarm system inside your house, if you have bars on your house, all this brings down your homeowners insurance. If you drive safe, you're not driving reckless, you don't get speeding tickets, your auto insurance goes down. In healthcare, it's one size fits all because of affordable health care. We want people to have choices, a choice that works for them. A 25-year-old that takes care of himself, that works out, that's not overweight, that doesn't smoke, doesn't drink, doesn't use drugs, and doesn't dip, shouldn't have to pay the same insurance premium as a 50-year-old that smoked his whole life, that doesn't work out, that's extremely overweight, and has bad health and bad personal choices. So what President Trump is saying, bring choice back to the healthcare market and give those subsidies to the American people. Let them have choices rather than the insurance companies forcing plans on us that we don't want.
Yeah, it has to be done right. Capitalism, obviously. If there's not competition, or if the government gets involved around the edges with well-intentioned, provisions and regulations, usually that will dampen the competition, and then you get the situation. Right. The president wants the stock market to go higher. The people that own United Healthcare, that watched it go from a much lower price to a much higher price, that is a good thing. But you're right. If it's because of a lack of competition, or where there are subsidies coming from the federal government that aren't, that are increasing the price of healthcare and healthcare inflation, that's the wrong way for the stock to be going up. So as long as we make all that clear, I mean, at this point, if individuals were able to pick exactly what they need and not pay any more for it, not get Cadillac plans when you're 25 years old, if all around the country insurance companies could go, interstate and not be, just domiciled in one place, all those things, do you think are sufficient to bring affordable health care to people without Obamacare?
Well, listen, Obamacare, as I said, affordable health care doesn't work, and we need to quit trying to prop it up and make it work. I think the Democrats' whole goal is they knew it wasn't going to work. They had a community organizer in President Obama that tried to sell us a bill of goods that isn't working. So let's let a business guy that actually knows business help negotiate a health care for the American people that is affordable and that the American people have choices. However, Joe, what I'm concerned about is the Democrats talk a lot about health care, but are they willing to admit that affordable health care is not working? And can we leave the politics out of it and put the American people first? Right now, the Democrats continue to use their constituents as leverage points. This isn't about leverage. This is about health care that might actually work. Right now, the Democrats are saying that the Republicans broke this. Obamacare broke this. They know it. They voted for it. There wasn't any Republicans that vote for it. Now they're saying because we're not extending a premium tax, which puts literally a little bitty Band-Aid on an open wound to try to bring down the premiums, it's our fault that the affordable health care is unaffordable. It doesn't work this way. But if we are able to leave politics out and let policy run, allow people like Chairman Bill Cassidy or John Barrasso that are doctors and bring in the professionals from hospitals to physicians to even insurance and private sector and allow them to come in and try to have a conversation about what could work in the sector other than allowing politicians to use it for talking points, we might be able to fix a system that could be affordable and be a free choice in an open market and a capitalist society.
The devil's in the details. I'm trying to figure out how you don't want an individual mandate, but you want to induce people to stay covered because Obamacare, as expensive as it is, and with all of its issues, it did cut the rate of uninsured people in the United States. I think it probably cut it in half. It's expensive. The minute people leave that system, they're back in the emergency rooms getting free care that's going to be paid free. That's going to be paid somehow. So, we don't want to increase the ranks of the uninsured again. And that's why this has to be done in a way that induces people to get the best plan that they possibly can at the best price that they can get it.
Well, but you do that by bringing in competition, not consolidate. Right. And after affordable health care was passed, it consolidated the industry and brought less choices to the market. Right. We know that works. If we bring choice in, let people choose, and bring competition to the market, it automatically brings down the price.